All right, today we're jumping right into the deep end, into the high-stakes world of emergency medicine. We're going to break down a condition where literally every single second counts. This is type 1 respiratory failure.
So, picture this. It's a scene that happens in ERs all the time. A 37-year-old woman is rushed in and she is in serious trouble. She just can't breathe. You can feel the tension, right? The clock is ticking and the doctors have to figure this out, and they have to do it fast. This isn't just about getting a diagnosis on a chart. It's a flat-out race against time.
Okay, so that race started the second she came through those doors. Let's break down the very first clues the team had to go on.
So here's the rundown. For about a week, she just thought she had a really bad cold, a fever, cough, the usual. But now she is struggling for every single breath. Her respiratory rate is way up, like 26 to 28 breaths a minute. Normal is way lower. When they listen to her lungs with a stethoscope, they hear this crackling sound. They call it bilateral crepitus. That's a huge red flag for fluid. And sure enough, the chest x-ray confirms it. There's this haziness in both lungs. Something is going very, very wrong in there.
And then they get the first really scary number. Her oxygen saturation, just 82%. Now, to give you some perspective, you or I, sitting here right now, should be at 95% or higher. So 82, that's not just low, it's a massive flashing red light. Her body is literally starving for the oxygen it needs to survive. That little clip on her finger, the pulse oximeter, it gives them a huge clue, but it doesn't tell the whole story. To really get what's going on, they have to go deeper. They need a direct look at the gases inside her blood.
So they do what's called an arterial blood gas test, an ABG, and this gives them the next big piece of the puzzle. Her partial pressure of oxygen, or PO2, comes back at 52. Okay, so what does that number 52 actually mean?
Well, that dangerously low number has a name. And this name is at the absolute heart of this whole emergency. The question is, what is hypoxemia?
Hypoxemia, when you boil it down, is just an oxygen crisis in the blood. Plain and simple. The lungs are failing at their one fundamental job: get oxygen from the air we breathe into our bloodstream. And when it's this specific kind of failure, where oxygen levels crash but CO2 levels are kind of normal, that's what doctors call type 1 respiratory failure.
And just look at this comparison. It's just stark. A healthy person's PO2 should be somewhere between 70 and 110. Our patient is at 52. This is not a small dip, folks. This is a catastrophic fall. Her cells are screaming for oxygen. So, we know the what. It's severe hypoxemia. The billion-dollar question now is, why is this happening?
Okay, so the search for answers pivots. It goes from her blood right back to her lungs. Remember that hazy x-ray? That was the big clue. It's pointing to some kind of devastating inflammation. Let's dig into the chain reaction that's unfolding inside her body right now.
And the culprit has a name. It's called acute respiratory distress syndrome, or ARDS for short. Now, what's crazy about ARDS is that it's not some virus or bacteria attacking from the outside. No, it's the lung's own immune system going haywire, an overwhelming self-destructive reaction to some kind of injury, which in her case was probably a nasty infection. This really breaks down that destructive domino effect. It all kicks off with an initial injury, probably a pneumonia in her case. Her immune system, doing its job, sounds the alarm. It unleashes this flood of inflammatory messengers called cytokines. But here's the problem. The response is just too powerful. It's like sending in a wrecking crew to fix a leaky faucet. These signals start damaging the super delicate walls between the air sacs and the tiny blood vessels. That damage lets fluid pour out of the blood and right into the air sacs. The end result? Her lungs are, and I mean this literally, waterlogged. And you can't get oxygen through a flooded lung.
All right, so the leading theory on the table is ARDS, but you can't just guess. The doctors have to confirm it, and they do that by connecting the dots between the theory and what they're actually seeing with the patient.
And when they look, everything lines up perfectly. That shortness of breath, the racing heart, that's her body in full-on panic mode, desperately trying to get more oxygen. And as the brain starts to feel that oxygen shortage, the patient gets confused and anxious. In really bad cases, the skin can even turn a little bluish. That's called cyanosis. Our patient? She's checking off every single one of these boxes.
To make the diagnosis official, there's actually a system for this, called the Berlin definition. It's all about something called the P/F ratio. It sounds complicated, but it's basically a simple way to measure how well the lungs are working. It compares the oxygen in the blood to the oxygen being given to the patient. And the rule is simple.
The lower that number, the worse the ARDS is. This helps them classify it. Is it mild, moderate, or severe? And knowing that is absolutely crucial for deciding what to do next.
And just like that, all the pieces of the puzzle click into place. The final diagnosis goes on the chart: acute hypoxemic respiratory failure, type 1, caused by ARDS. The why has been found, the mystery is solved, and now the real fight begins.
So what do? How do you treat a condition where the body's own security system has gone completely rogue? Well, there's a clear, methodical plan. It's basically a three-pronged attack. The strategy has three main goals. Goal number 1, fix the immediate oxygen crisis. That's all about airway management. Goal number 2, treat whatever started this whole firestorm in the first place, like give antibiotics if it's pneumonia. And goal 3, keep a close eye out for any other problems, managing any complications that pop up from being this sick. Let's zoom in on that first step, because it's the most urgent one. Airway management isn't just one thing, it's a spectrum. It could start with something as simple as an oxygen mask. If that doesn't cut it, they might try a non-invasive machine like a BiPAP. But for someone as sick as our patient with severe ARDS, they're likely going to need full mechanical ventilation. That's a breathing machine that completely takes over the job of the lungs, buying them precious time to rest and hopefully heal.
This quote really hits the nail on the head. When you're dealing with ARDS and type 1 respiratory failure, there is absolutely no wait-and-see approach. You have to act fast. Early detection and aggressive treatment, that's everything. The gap between acting now and waiting, that gap is measured in human lives.
So, let's just quickly recap what we've covered. Type 1 respiratory failure is a flat-out oxygenation crisis. It's usually kicked off by that destructive domino effect of ARDS, which you can see in how that PF ratio just plummets. But here's the hopeful part. By using a systematic approach to figure it out and a clear three-part plan to treat it, there is a path forward, even for patients as sick as the one we've been following.
And all of this leaves us with one last, kind of mind-bending question. Think about it. Our body's own defense system, our immune system, is designed to be our ultimate protector. So how on earth can that very same system, using a tool like inflammation, sometimes become our single greatest threat? How can our guardian turn into the attacker? It's a fundamental paradox, and it's right at the heart of so much of medicine.